Good evening, Bahamas. Coming up tonight, a union leader blasts an invitation to meet with the Prime Minister. Meanwhile, the National Health Insurance Authority works on a new system of payment. And a union representing hotel workers is celebrating its 60th anniversary.
Our news is brought to you by Alive.
Welcome to our news and thanks for joining us. I'm Jared Higgs. Topping news tonight, as labour tensions escalate, Prime Minister Dr. Hubert Minnis is holding a meeting with all labour unions at his office in a bid to address their many concerns. This comes as the Consultant Physician Staff Association heads into week 2 of its strike. While Labour Minister Dion Folk says he confirmed the attendance of the leaders of the country's 2 largest umbrella unions, that meeting may be missing some key players. As union after union eyes industrial action to resolve its issues, Prime Minister Dr. Hubert Minnis is seeking to intervene, having invited all Labour unions to his office for a Monday morning meeting. Minister of Labour Dion Folk announced the meeting in the Senate on Thursday, saying that the heads of both umbrella unions had accepted the invitation. However, Trade Union Congress President Obi Ferguson says their conversation went a little differently.
I got a call from the Minister of Labour concerning a meeting with the Prime Minister for all of the unions on Monday. I got no further call from the minister. He didn't confirm a time with me. I subsequently found out about 20 minutes ago from Mr. Evans that there's a meeting, the meeting is scheduled for 10.
Ferguson says given a previous commitment, he won't be able to attend the meeting.
I am in the Court of Appeal at 10 on Monday. So obviously, Obi Ferguson, as president of the TUC, could not be there. Even if we wanted to be there, it's just impossible.
The TUC president also slammed the Prime Minister's meeting, telling Our News there was simply no way any union could properly air their grievances with dozens of unions in attendance. With more than 100 senior doctors striking and junior doctors and nurses preparing for strike votes, he says he requested a meeting specifically to deal with the medical issues.
The president of the Consultant Physician Staff Association, Dr. Loxley Monroe, the Bahamas Doctors Union President, Dr. Bassett, along with the Bahamas Nurses Union President, Ms. Amansha Williams, expressed the view that they would like to meet with you as a medical unit to address you on the bargaining impasse. They are of the view that the issues are homogeneous in nature and would be conflicted with other unions' issues that are not medical in nature.
Consultant physicians withdrew their services on Tuesday, November 27th, saying they would only perform emergency procedures at public hospitals and clinics. This resulted in the Public Hospitals Authority activating its Emergency Operations Centre, telling members of the public to only come to the hospital if they have an emergency. And as tensions rise between senior physicians and the Public Hospitals Authority, the National Health Insurance Authority is working on a new system for payment. Kyle Joaquin has the story.
So what we are saying is that National Health Insurance will change the reimbursement mechanism for both the institution to collect its funds and for the physicians and nurses to be paid because there'll be more funds available.
During our sit-down interview, Robert said the current system of reimbursement for consultant physicians is kind of old and definitely not reflective of the amount of time and effort these senior physicians put in now.
And so We are in a position today now where we are saying we are no longer the 20-hour physician. We are the 80 plus and 100-hour physician, consultant or senior level physicians. These are physicians who have, after high school, have spent an additional 15 years of training to become the experts in their field. And so they've come back home now, they're working at this level and they're saying, okay, how much do you value our service?
A policy paper released by the NHI Authority late October outlined the new proposed framework for an expanded NHI, and it raised some eyebrows when talks of a 2% payroll tax was brought up. But as consultant physicians take action amid unrest with the Public Hospitals Authority, Robert says the NHI Authority is working on a way to change how these consultant physicians are paid. Here's how.
One of those mechanisms would be a fee-for-service basis, and not only that, you can do a fee-for-service basis, what we call a value-based driven system. So, in other words, when you see a patient, here are the things that you need to do. I want to make sure that you do you should send in all the documents you need to the patient. Show me that you've seen the patient. Show me you were there operating on the patient. Show me what are the outcomes of the patient. Show me that practically most of your patients did not get an infection. They didn't stay in hospital any longer than what they did and so on. So if we have these benchmarks of performances and you approve that, then I'm going to give you an extra 10% or whatever. So you see, you can put in these performance measures where you're being paid on a fee-for-service basis, but your value in terms of what you're doing to improve the outcomes of the patients will be better.
The consultant physicians in the public healthcare system withdrew their services last week. Dr. Roberts said the doctors aren't being malicious, but are simply seeking to be given what they're worth.
And I'm quite certain that the physicians, the senior physicians, will not be irresponsible and leave the patients uncared for. I am sure that if any incident happens with any patient right now, and that senior level physician is required to be there, they will be there.
For Our News Weekend, I'm Kyle Joaquin.
Meanwhile, a consultation is still underway between the National Health Insurance Authority and stakeholders. NHI Authority Chairman Dr. Robin Roberts said after engaging in talks with those stakeholders, it became evident more time was needed.
In terms of the consultancy, in terms of the engaging our stakeholders in the National Health Insurance. So we had a date set for December the 10th, but we realized that there are some areas that will not be covered yet. We have only gone so far to Exuma and Freeport. So we also want to go to Long Island, we want to go to Lutra, we want to go to Abaco. So we know but this is Christmas time in the Bahamas now. So that'll probably go into January, okay?
Aside from the stakeholders and private insurers, the authority is holding a series of town hall meetings to engage the public on the proposed changes to NHI. In addition, the public can submit responses through an online consultation survey on NHI Bahamas' website.
We still have some town hall meetings that we would like to do in Nassau. And so we are trying to organize our first one within the next 10 days, and we know there are at least one or two more that we want to do. So that would not happen until in January. So we see whereby this period of consultation with the stakeholders, the public at large, and all the different NGOs and those businesses will probably extend into the early part of the year.
Still to come on Our News, a union representing hotel workers is celebrating a milestone. We'll have that and more when we come back.